I think what inspired me to do medicine really was following my dad on ward rounds. And I would go with Dad on a Saturday morning to St. Vincent's. And what struck me was the way he treated everybody that he interacted with respect and kindness, and responded so beautifully to all the patients and families, but also to all of his colleagues. And I think he was very much loved for that. And it inspired me to think this is what I would like to do as my career. So it was 1998, I joined the staff of the Royal Children's Hospital, and I'd just come back from maternity leave. I had 5 young children and I was looking for a little bit of part-time work. So I thought this would be great. I'll do a couple of days a week at the Royal Children's. And I was asked to perform the bone marrow tests and lumbar punctures on children with leukemia. Now, leukemia, as you might know, is a fairly devastating diagnosis for a family and a pretty difficult thing for them to be faced with. And coming in to do their procedures, I actually became quite distressed to think the children were sometimes needing to be restrained and held down in a soundproof treatment room so that we could do their procedures. And they would come maybe 50 times over 2 to 3 years to have these treatments. And I started to think, goodness, what if this was happening to one of my children? I don't think I would be coping terribly well. So I did something that was a little unusual at the time, and I sat down with a group of the families, and I asked them, could you tell me about the journey when you've got a child who's very sick? What are some of the touch points in that journey where we could make a difference and make it easier for you? It was very early days for what is now called patient and family-centered care, really listening to the voice of the patient and family to help us to make improvements and make that journey and experience more tolerable for them. The families were extraordinary. They came up with all sorts of suggestions for how we could improve the system. And these were things that us as health professionals just can't really know because we're not walking that journey. I found out things like, did you realize the bins in the ward are emptied at 2 o'clock in the morning? Now, somebody in the system has made that decision that that's sensible, but the families have just got their sick child off to sleep at 10 or 11 o'clock at night, and the ward is finally quiet, and someone comes in and goes bang, crash, wallop, and empties the rubbish bins. The only way to know those things is to go to the source of the people who are living it. And to me, it was such an eye-opener to hear their point of view. Other things they could talk about were when the care didn't look safe to them. So the parents become very vigilant and aware of what's being done to their children, and they're actually very good at helping to check medication, yet they're not routinely made to be part of that system. And I started to see where they could really help us to stop things going wrong in healthcare, if only we made the culture safe enough for them to be able to speak up and tell us what they noticed or what they were worried about. I'd have to say it wasn't all easygoing because a lot of my colleagues back in the 90s found this fairly threatening, to think that we were going to listen to what the patients and families had to say and bring that into our thinking and into our design of what we were going to be doing. But to me, it was quite compelling because they just knew so much about the system and could be such valuable allies to us. And in fact, the families are always extremely grateful for the care that we're providing to their children, or even in adult care. The care that we provide in the Australian healthcare system is extraordinary, but we could make it so much better, valuing the voice of the patients and families in all our decision making. So one of the things that the families talked about was the environment in hospitals. Coming into a hospital, particularly with a sick child, you're vulnerable and scared, and the sounds and the sights of a hospital can be quite overwhelming. This is where my interest in bringing music in came about. The family said, what about music that we could have in this environment to help calm everybody? And so my children were learning from some professional musicians at the time, and I spoke to them and I said, what could we do about this? And they went, we would absolutely love to help. So I started to bring Australian composers and musicians into the hospital, to the operating theatres, waiting rooms, treatment rooms. And it was a fascinating process. I had no idea 20-something years ago what this would evolve into. But I would put a composer in the corner of an operating theatre and let them just absorb what was going on. And from their creative mindset, they would say to me things like, this is extremely challenging. The noises and the cacophony that is going on here raises everybody's anxiety, not only the children and the families, but also the staff working in that sort of environment. And these composers would say, we need to think really carefully about where the music could sit in this soundscape and not actually make it worse and not raise people's anxiety more. So back in the year 2000, the first composers came up with music that we could use in operating theatres and hospital spaces. We just had one CD and I would play it in my operating theatre, and people kept walking past and having a listen and going, this is beautiful. I wish, could I get a copy of this? So I'd take it home and I'd burn a copy on my CD burner. And by the time I'd done this about 50 times, I thought there might be something in this. So I have a bit of an entrepreneurial streak to me. And so I approached Australia Post and I said to them, I've got this idea. We've made a beautiful CD of music for hospital spaces that's been specially designed. We'd like to sell it to the public so we can get it out further. And in those days, Australia Post had none of those things for sale in the post offices. And we were the only thing, a box of CDs that said, the money raised from the sale of this CD is going back into music therapy and pain management for children in hospitals around Australia. And the CDs just walked off the shelves. It was quite amazing. And that really led us to setting up the Hush Foundation, which now is 22 years old and has gone from strength to strength. So we've had composers like Paul Grabowski, Tony Gould, Slava and Leonard Gregorian, Nigel Westlake, so many, in fact, about 88 composers have provided the most extraordinary music, which has now gone not only Australia-wide, but international, into hospitals, aged care, palliative care. It's played by orchestras around the world. The idea, I think, really did take off because a lot of people resonated with this idea that a hospital is not necessarily a calming and healing environment when you go in there. And this music really does help. So I did have a lot of opposition from some of my colleagues at the time, as I said, and that led me to think perhaps I needed to get a little more background into what's going on internationally. So in 2010, I travelled on a Churchill Fellowship, and that was a life-changing experience for me. I travelled to the US and the UK and to Ireland, and I looked at patient and family-centred care, linking it to that idea of patient safety that I was talking about before. The idea that if we can think about improving the safety of everything we do, it's such a compelling argument that even some of the people lagging a little bit on understanding how much the patients could help us, they're going to come on board if they realise that this is really about keeping the patient safe. So travelling around, I was fortunate to meet some of the world's most amazing patient safety experts. And what I gleaned from them was that, in fact, there was a missing piece in what I'd been saying about patient and family-centred care. What the international experts said was that the next big challenge for patient safety around the world is how staff treat each other. And I think Yvonne and others will understand this, but it's really a very important link, that if staff are not treating each other with respect and with kindness, actually it makes it very difficult to do your job. And I realised that one of the reasons patient-centred care was not getting the traction that it needed was because staff were not feeling cared for and valued and treated with kindness. And it meant they were really without the capacity to go above and beyond and to do more. And I'd hear nursing staff say, look, we are doing as much as we possibly can. Don't tell us that we have to listen to the patients and families as well. This is all too much. I was quite disturbed to think about all of this. And with my creative hat, I thought I'd like to get some of these messages out into the healthcare community more broadly, but do it again through the arts so that it may pique people's interest and really get them talking about it. So I connected with the playwright Alan Hopgood, and I gave Alan a whole lot of stories, true stories from healthcare, patients, families, from healthcare staff who'd suffered bullying and harassment and had burnt out in their work life. And Alan has written for the Hush Foundation 3 extraordinary plays that we've now performed over 200 times in hospitals, in aged care settings, and at conferences internationally. I'll tell you a little bit about the first play, which is called Hear Me. That's a play of a devastating medication error. So a young person dies as a result of being given the wrong medication. Her mother knows there's something wrong and she speaks up repeatedly, but she can't get the staff to listen. In fact, they label her as difficult and they say she's disturbing the ward. The junior doctor who makes a mistake doesn't feel safe to admit to the mistake because she's been bullied by her consultant over and over again, and she's come to the stage where she doesn't want to be humiliated anymore. And the audience is watching this unfolding disaster. At the end of the play, the CEO gets everybody together and says, how did this come about? But the audience, in fact, has picked up on it as it's gone, and they've seen that the interactions that are going on behind the scene are a lot of the problem. When we do the play, it takes about half an hour, and we tend to get anywhere from 50 to 250 staff in the room at once. And we have a facilitated discussion with them about the issues that it's raised. The impact of the arts in that sort of a setting has been quite extraordinary because it brings out conversations that we haven't been brave enough often to have. I'll give you an example. At one hospital, the play finished and an executive member got up and said, oh, look, that was a good play, but that Dr. Henty character is an old-fashioned concept, doesn't exist anymore. Now, Dr. Henty, in fact, is the older style consultant who is intolerant of the junior staff, particularly if they're a little bit slow or they don't know the answers or they might make mistakes. And it's his intolerant attitude, actually, that has caused a lot of the problems. So she made this comment that that character really is overplayed, followed by a junior doctor who stood up and said, well, I'm sorry, those characters are throughout this hospital. They hold your career in their hands and there's no one safe here, you can tell, because you won't have a job next year. The other junior doctors then put their hands up and said, we're standing with her. It was quite extraordinary and a message to the leadership of that hospital where they thought the culture was fine and that everything was fine. So we've found this very powerful, and we collected data from 15,000 people who completed a postcard anonymously to tell us what are 2 things that you think your hospital could do as a result of seeing the play, and what are 2 things that you could do personally to improve the culture in healthcare. And the message came to us really strongly that there is actually a crisis in the culture throughout healthcare, in fact, around the world, of how staff are not feeling valued and treated with kindness, and how they don't treat each other with kindness necessarily. Being overwhelmed with this negativity, I thought we really need to flip this on its head. What if we changed the conversation and we just park the fact that we do have some bad behaviour and culture problems that need dealing with? What if instead we aspire to a kind health system? What would that look like, and how could we work together to build that? The system that we would all want for the future, a system that's kind for the people doing the hard work in healthcare, and one that's kind to the patients receiving care. Interestingly, when we started the Gathering of Kindness in 2015, we had 100 people from all walks of life. We got together over a couple of days and we brainstormed what this could be. And it's grown into a movement now of thousands of people. We run events, we put out small videos of tips and ways that you can interact with your team to bring kindness to the fore. We bring the evidence of how kindness can make such a difference. And what we found is it's a very empowering concept, because in fact, if the CEO is not on board with this, if the executive team are a bit slow coming to the realization that they need to do more for their culture, every single staff member can, in their own small circle, make a difference day by day. So people will come to some of our events and they will go back to work the next day with a changed attitude, and the attitude that kindness is actually contagious. You can, on MRIs now, see that the mirror neurons light up when you're kind to somebody else. It lights up in your brain, it lights up in their brain, and they're more likely to go on and do something kind to the next person they bump into. We do all know the opposite, which is the, road rage. If you start tooting your horn and getting all aggro, the next person's more likely to be aggro with you and the situation unravels. But you can step back and you can take some action yourself. And I think this is why staff in hospitals are really finding this quite helpful. Last year, of course, we had to rapidly readjust. All of our live plays have been cancelled, but we were lucky enough to get a small grant from Creative Victoria to turn the plays into radio plays, the old-fashioned radio plays. And it was fantastic how the actors who had been expecting to go live would sit at home, and we send them all the microphones and the equipment that they needed, and it was all put together in these beautiful packages, which we can now put out for staff training with a facilitated, some facilitator notes that go with it. So there've been different ways to still manage to do our events. And I would have to say that the COVID pandemic made people more interested in our work. I think it made people realize we need an environment that is calming and healing and helps us when we're under a huge amount of pressure. So we've had more requests for our music now than ever before. The radio plays are starting to roll out. And we put all of our Gathering of Kindness events around World Kindness Day last year onto a webinar setup and had 1,000 people in one day, which was just extraordinary. So I think what I'd like to do is just implore everybody to have a think about this in your everyday life, in your work. It's a simple concept, and at first I thought, well, maybe people aren't going to be all that interested, but it's invigorating and inspiring when you see it happen, and when you see a team start to really come together well because of the way they're treating each other. So going back to the children having their bone marrows and lumbar punctures, from those early days when I spoke to the parents, one of the things they talked about was improving the pain management and improving the environment. Now we put all the children pretty much off to sleep under a very brief general anaesthetic for their procedures. We've got music therapists in the waiting room. We've got the hush music in the operating theatre when the children and the parents come in. both the children, their parents and the staff all say what a difference the music in the background is making to how they are able to cope in that room. And we used to have a culture in our team of silos and divisions. Our operating theatre has 7 different teams all working together. It's taken a reasonable amount of work to get everybody on the same page and to really think about our interactions at every time and making sure that even if things get busy and stressful, we pull out the kindness. When we're busy, we pull out the kindness, and it actually helps us to get through our work better. So we now have a team where it just wouldn't work for somebody to be gossiping about someone else in the corner. It used to be fairly common, and I think Yvonne's probably seen this in healthcare, that people gossip about other teams. They're negative about, you know, the emergency department. Why didn't they do this? Why didn't they tell us that? Certainly nursing staff, when they were bringing patients down to the theatre, our nursing staff would say, well, they should have come sooner and they should have hung the platelets before they came, etc. When you get people to realise how that negativity can make the workplace such a difficult environment to work in and make things less safe and have your colleagues disengaging from the work, really, we all have a responsibility to do better. And now what we've got in our operating theatre is people who are actually reaching out to help each other. We have a huddle in the morning when we first meet. We introduce everybody in the room, what their role is, what they're going to be doing. We check in to make sure everybody's feeling good. Putting some of our vulnerabilities on the table in front of other people has been really helpful to link us and help us to collaborate better. It really started, I think, with me one morning explaining to the team I was feeling extremely shaky and wobbly because one of my kids had been, my teenager had been misbehaving. He had been selling fireworks out of his wardrobe at school, and I had found them before I went to work. So I was actually thinking, my goodness, the police might even be there by the time I come home. You know, this is a disaster. How am I going to get through doing all of these procedures on really sick children? So I put it on the table in front of the team. I said, I'm not at my best today. And they went, Cathy, this is okay. We're a team. We've got your back. We're going to help you check the chemotherapy really carefully this morning so that it all goes smoothly. That was a bit of an icebreaker. And now people are actually happy to say, things are not all okay at home, you know, or I'm having some problems with something, or I'm a bit worried. Bring that to the table so that we can all help. We also now have a safety check-in, a safety moment before we start the day. So that idea of talking through what the families might have noticed that is a problem with their child, or some other safety issue that's gone on in the room. It's built quite an amazing teamwork. We've increased our efficiency probably 30% in what we can get through. So this idea that you may be too busy to be kind, I would absolutely throw out, because we've proved that this pulling people together in a place where they feel safe and secure and treated with kindness, they can do their absolute best work. So I'd like to explain to you now where the gathering of kindness, where I hope the gathering of kindness might go, and people are welcome to get involved and help us to build this movement. At the moment, we've got something like 35 hospitals around the country signed up to be part of our programs, and we regularly give them teaching and education materials for their staff, ranging from really short, sharp, a minute and a half, somebody like Elizabeth Broderick talking about the importance of kindness and whether we are too busy to be kind. And then a couple of questions that you can talk about in a staff meeting. up to, say, 20-minute talks from international experts about how they have used kindness, or even in the UK, the word civility comes up a lot. And what we're trying to do is spread this further so we can have pretty much every hospital in Australia signed up to be thinking about kindness amongst their workforce. We know that it will make a huge difference in patient safety, in staff safety and wellbeing, in the retention of staff. It's quite a problem at the moment of retention of staff in times when people are getting burnt out and they're not able to really bring their best selves to work. So with some simple tips about kindness and how to interact, we know we can make a difference. This year, we're rolling out another program around World Kindness Day, which is November the 13th. It's around the world, it's celebrated on November the 13th, which is a Saturday this year, where we've previously been to Government House and done a beautiful event with the Governor and support from Rotary. We're hoping to do something similar to that again this year. So if people have ideas of how they can get involved or how we can spread this movement, we would be absolutely delighted. And I was saying to Jeffrey, we've got a lot of resources that we can share with you. We've got some on our website, but also during the pandemic, the Tasmanian Symphony Orchestra, who had done one of our albums of music, put each of the pieces of music to the most beautiful videos of underwater and Tasmanian scenes and the wildlife and the nature. And they're absolutely extraordinary for going up onto big screens, say in emergency departments or waiting areas, instead of the television with commercial TV, which is at times not really appropriate for that sort of environment. We would love to work out how we can get this onto screens absolutely everywhere, and it's freely available. I'll share them with Jeffrey and he might be able to then pass them around to anybody who's interested. So that is probably enough talking from me. If anyone would like to ask any questions, I'm happy to help.
Thank you so much for that, Catherine. I think that was, I found it fascinating and interesting, and I'm sure everyone else did as well. But just before I open it up to general questions, and while people think about what they might want to ask, I'll sort of use my privilege to ask a question, if I might. In this, as you've developed all of this program, has there been something that was totally unforeseen and totally unexpected, something that you might have thought, well, I really didn't expect that to come out of this?
Well, quite a few things, Jeffrey. I'd say every year something like that has happened. Certainly when the idea to compose music first came about, I really didn't see that it would still be going over 20 years later, and that it would have gone from strength to strength and would have gone international, really. I think that was a big surprise. Then when we wrote the first play, we had no idea if anyone would be interested or how we were going to show it to people, and put it on at one hospital and they told their friends, and next thing we were on this basically on a tour. In fact, we did 17 performances in 3 days up in one region around Benalla and Wangaratta and all that area. That was quite extraordinary. And the impact each time and the things that we learn are different from every hospital. So really, I just have my eyes opened with this whole journey. A lot of stuff, we just go by the seat of our pants, and it happens. Great connections seem to happen if you're open-minded.
Thank you, Catherine.
Nice to see you, Craig.
So beautifully said, and such wonderful work. So it was a real pleasure to hear all about it and the backstory. I've done a little bit of work supporting Debbie Ling, who's doing a lot of work with compassion and common humanity in the healthcare system. Have you crossed paths with Debbie?
We have crossed paths, yes.
Yeah. I just had a question for you, because you're talking about kindness, and then the language of compassion is used a lot, and then common humanity. I just wondered, I mean, are these different things, or all part of the same thing? If, for example, you have a sense of common humanity, your connection with somebody else, is kindness and compassion just a very natural side effect of that, a consequence of having that connection? If you break that connection, me, other, then it's very easy to be cruel or inconsiderate and so on. I'd just be interested in your thoughts about that.
I agree with you. I think it's all one big pot. Empathy is another one that's in there too. And the different terms, I think, are all slightly different, but I think they're all complementary. And when I first got to talk to Debbie about common humanity, I loved that term. I thought that really did epitomise what we're trying to do. And basically, I think it is the human-to-human connection, and that part that in some of our medicine we might have lost, that we're very good now at the technical and the medical, but that common humanity has sometimes drifted away. And going back to my dad and my uncle, I've been quite disappointed sometimes in my medicine that what I saw with them, I didn't see sometimes in other health practitioners who had maybe become burnt out and then were not able to hold on to that compassion and humanity. So COVID's been a bonus because it has made it much more acceptable to talk about it, and people have sort of understood it really quickly. Because otherwise the whole system would have collapsed last year if we had not seen so many acts of kindness and people just stopping and thinking, hey, the connection is so important. And Craig, we were meant to be talking about this next week with David Kopoloff, and now COVID stopped it one more time. Anyway, there's somebody asking in the chat about spreading this to other sectors and settings. Now, Craig and I, in fact, we're going to talk next week at Monash Uni, and I've got this idea that we might spread it across the whole campus. So kindness in the law, in politics, in the arts, in the education setting, it belongs everywhere. It's going to work. It's going to make a difference.
I'm an old-fashioned Anglican, and what you're talking about to me is hardwired into me, because that's always been part of my DNA. And I think the real success of me in business is I've been able to carry that through to our teams and everything else. So are we saying here is society's lost the Christian Judeo principles, and that we have to reinvent them and come through other mechanisms that you're introducing, Catherine? I've got to say it's a bit disappointing if that's the cause of it, from my point of view.
Look, I'm not sure what the cause is, whether it's the overwhelming busyness or the competitiveness of life. Certainly in medicine, it's fairly competitive, and I think that is part of the problem. But also that people are so rushed in their lives, and with all the technology, we can be losing the human-to-human connection. So maybe it's more about that than anything about religion. It's more that society is more fragmented potentially, which is partly why I think COVID could be seen as a possibility to restart some of these things, to really think about what matters and how to look after each other in our families, in our community, in our workplaces. I'd like to let everyone know that Hugh Mackay has just written a new book, which is called The Kindness Revolution. I could highly recommend it. And we've in fact interviewed Hugh, and we'll bring that interview out at the Gathering of Kindness in November. But he's talking about the extraordinary acts of kindness that have happened out of COVID, and how do we now capture some of that and carry it forward into the future. And I also think that with healthcare, what's the future that we want, and how do we carry the best parts forward, particularly out of COVID?
Sorry, what was that name you mentioned? Hugh
McKay, the
Yeah.
social commentator.
Yeah.
His new book is called The Kindness Revolution.
Thank you.
Thank you, Cass, for this talk. It's very, very timely. I've got a comment and a question. So my comment is it's timely because I think now even, and I've noticed this while I was talking to a friend just yesterday, her house was nearly washed away because of some problems with the rains and to do with Yarra Valley water as well. Her problem that she faced was that no one was actually being kind to her, and the team who talked to her was all about risk management and possible loss of profit and litigation rather than showing kindness. So I think that not only is this useful in law or medicine or in the various sectors, is also very apt in all aspects of life, no matter who we are. So that's my comment. The other thing I was interested in as a doctor is you've got great stories about all of this. Has any of this actually been, have you written up as research? Because sometimes I think it could be useful because upstairs, all our upstairs may be interested in say, what research results do you have?
I certainly did research in the early days of what the parents thought about their journey with their children with leukemia, and particularly around pain management. That has been quite useful, as you say, to get it published and get it out there so that people will listen and have a look at the data. Because of course, some of our colleagues are more driven by data than by the stories. At the moment, I'm in the midst of trying to write up the feedback, the qualitative feedback we've got from all those healthcare plays. A little bit held up by last year with COVID and with some health issues I had myself. But I think, yes, you've encouraged me. I'll try and get that written up too. But I've written a couple of articles with David Brewster from Cabrini, intensive care at Cabrini, about kindness in healthcare. And we're getting some really good responses to that too.
Thank you.
Thank you. My name is Hatice Bashar and I'm from the Order of Australia Association. Thank you very much for a very uplifting and very interesting discussion. My question is, I realize that you have been trying to promote the concept as well as what you're doing so that there would be more people taking up on the ideas and the innovative work you're doing. Because of the importance of social media, to what extent are you using the tools of social media, which seems to have an amazing reach at this day and age? Like, have you taken steps towards that, or is it already happening?
Yes, we're doing, we've got Facebook and Twitter, and we've got a couple of websites. So we've got a website for the Gathering of Kindness, and we've got a website for the Hush Foundation, where you can find out all about the music and you can work out how to stream it, etc. Yes, so we've started to do that, and I've got a bunch of young volunteers. They're much better at that than I am. And on Twitter, there's an active group who are interested in this sort of side of healthcare. So yes, we're making starts in that, and whenever we have any events and we put it up on Twitter, it actually gets international interest. So I'll be speaking at the College of Physicians and Surgeons in Scotland later in the year. And that came about through, they found out about us on social media.
Just 6 months ago, we moved into a retirement village, and it was a Ryman Health, and their whole policy is kindness. And from the manager, we had a bi-monthly meeting today, and everybody has to take care of each other. There's a lot of building going on now, and all the people who have the flags that say stop, go, fast, slow, everybody has to smile and wave and say hello as they walked out. That's a policy of the organisation, and it's really working.
That's
so
fantastic.
everybody here is very kind.
Can you tell them about us?
I can
tell them to look us up.
Yeah,
that would be great.
Because I think all
we would happily share some of our. Yeah, that would be great, Rosemary. Thank you.
Sounds good.
Hello, my name's Robin Byrne and I'm from the PLC Old Collegians.
Hello, Robin.
I was on a community health centre board for 35 years. And so in that setting, we actually did do questionnaires from our clients about how the services available. But I really think some of what you've been talking to us about is just really fantastic. When I was on the board, I attended the Victorian Healthcare Association conference every year, and I was wondering if you had presented at the VHA.
I did.
Oh, you have? Okay.
Years ago, but a very long time ago.
Yeah. It'd be great. I'll mention it to a couple of people. But see, across Australia, there's different healthcare is organised in different ways. So New South Wales, it's all the one sector. And so if an idea takes off in New South Wales, then it supposedly can be implemented across the sector. Have you found that? Is that correct?
That is correct. And once you get into the New South Wales system, then you're on a roll. One of our Victorian Gathering of Kindness proponents has actually just moved into a fairly senior role in New South Wales. And I think she's going to get more traction of this idea because she's got access to something like 179 health services all in one go.
I just want to echo what Yvonne said, that really, thank you, Catherine, for your presentation. It was excellent. I'm also an PLC Old Collegian.
Oh, hello.
Hello, yes. No, I really think it should happen. The kindness thing should happen not just in health, in the hospital area and the health area. It should echo every workplace. You know, it could be kind to each other and not have a culture of bullying, which I think is just abhorrent. And that's all I want to say.
Exactly.
Thank you.
Thank you. Very true.
Thank you for your inspiring address. I've had a lot to do with people at work throughout my whole life, and motivation and so on has been one of the areas I've tried to follow. But I wanted to refer to the Royal Commission into Aged Care. Now, the aged care scene seemed to be horrific when it came forward with the recommendations or observations relative to the abuse that was being handed out to between staff and patients in aged care. And it seemed to be there was one element missing that could be fixed relative to making more time available for staff to care for the aged care. But at the same time, there seemed to be an element of attitude of staff towards the patients. And I'm just thinking that your program should be overlaid as a specific requirement in trying to address the findings of the Royal Commission.
Yes, Terence, look, that's very interesting. And I think you're right. A program like ours is simple to implement, really, but it takes everybody back a step to thinking about how they're all interacting. So it's how does the organisation treat the people who are doing the work? How do each of the workers in aged care treat each other? And then how do they treat the patients? Yeah. So all of those levels really need to be addressed.
But there was a criticism of lack of time. And your program could suffer where there was actually in real time a lack of time and given to staff to actually care. That seemed to be what the findings seem to indicate, that the staff were given so much 6 minutes a patient to do their preparation for the day sort of thing. It seemed there's something wrong in that way. And so your program would have to be, there would have to be other elements that make sure it doesn't suffer from some physical aspect that has to be fixed.
Yeah, look, I think there are definitely physical aspects and rostering and some of the funding and how the staff in aged care are paid. Some of those things do need to be fixed. But in the meantime, you can still start to bring in a kindness program until you've got all of those other things fixed. Right. Often people say, well, we're not going to start anything until it's all fixed.
Right. Well, I'm 85.
We might be waiting.
I'm 85, so I'm trying to prepare the way. And so I need your telephone number. If I end up in a nursing home, I need it in my directory. And I'll put it there now.
Get it from Jeffrey. Jeffrey can give it to you.
I feel a bit out of sorts because I'm not ex-PLC, but
that's okay, Robert. We don't mind.
I'm a pediatric surgeon, and I'm very grateful to have heard your talk. And I think people who deal with children all the time actually do have a sense of kindness that some of our adult colleagues do not possess. However, I would like to add that you may know the College of Surgeons has 5 values, one of which is compassion, and it has 10 competencies, which include collaboration, teamwork, and communication. I work at Monash Health, amongst other places. And at Monash Children's Hospital, we have 2 excellent simulation centres. And I've been part of a program of making films to introduce to people who wish to start surgery in Australia and New Zealand, competencies that will help them achieve their aim. Now, one of the ones that I do, that I've been involved in several, but the main one that I do is the attitudes in theatre, in the operating theatre. And I must say, I have a copy of your original discs, but I haven't followed it up in being involved with your organisation. But included in those, several surgeons are involved, and we do things individually. And as I say, I've been involved in introducing them to attitudes in theatre, including the huddle, and respecting everybody in theatre, whatever their capability, so that people, if anybody thinks that somebody is not quite right in the theatre, they can say so without feeling out of place, out of sorts. I'm sorry that I can't show a video because I live in Gippsland and we don't have broadband, we have narrowband.
Oh, okay.
And it's pretty awful. So, but I do want to say thank you.
It would be great to be in touch. I'm interested in what you're doing. I'm very well with what we've been doing.
Yes. Okay, that's good. Thank you.
Maybe Jeffrey can connect us.
Okay.
I think we've probably got to the time. We said this was going to go for an hour, so I think we need to honour that. Catherine, thank you so much for your presentation, and you obviously have generated a lot of interest among so many people who've responded. There are a couple of things that I picked up and sort of noted as we went through, and particularly if people are not treated with kindness, then it's difficult for them to actually do their job and to go beyond. I think that's the message that really we all need to take to heart, because this is not something that is limited, and the various speakers and questions have picked this up. This is not something peculiar to your particular field or your particular area of work or expertise. This is something that we all need to take to ourselves, and to recognise that as we live and as we work, as we interact with our fellow beings, kindness is really such an important part of what we need to do. You said it's contagious, and that of course puts a responsibility back onto each of us, because if we're going to encourage people, and if that contagion is going to start, then it has to start with us. In an environment of kindness, you said, people can do their best work. And again, I think that's really the final comment that I wanted to make out of this, and to say that again, there's a message there that we all need to take to heart. So thank you very much. Just as we close, I want to say thank you to all you people who have joined us. If you're a recipient of an Order of Australia but are not a member of the association, then I do encourage you to join. You will have received information at some point about that. And if you would like to get more information, then please look at the Order of Australia Association website, or you can contact me using the link that was in the correspondence that you received. But now, thank you very much, everyone, and good night.